everyone, and welcome back to my YouTube channel. Today, we are going to explore an important topic that affects many people. So, yes, I'm talking about post traumatic stress disorder, which is commonly known as PTSD. So, if you are curious about homeopathy or seeking natural alternatives for certain health concerns, then this video is definitely for you. So, watch this video till end for more knowledge and stay connected with us for more informative videos like this. So, join me as we unravel how homeopathy can play an important role in the holistic treatment of post traumatic stress disorder. So, first of all, I would like to explain what exactly is the meaning of post traumatic stress disorder. So, let's talk about it. So, PTSD is a mental health condition that is caused by an extremely stressful or terrifying event, either being part of it or witnessing it. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the events. And most people who most people who go through traumatic events may have a hard times adjusting and coping for a short time. But with time and by taking good care of themselves, they usually get better. So if the symptoms get worse, last for months or years, and affect their ability to function daily, then they may have post traumatic stress disorder. This is the exact meaning of post traumatic stress disorder. I hope this is clear to you. Next, we'll talk about the clinical features. That is, what are the symptoms of post traumatic stress disorder? So, symptoms may start within the first 3 months after a traumatic event, but sometimes symptoms may not appear until years after the event. These symptoms last for more than 1 month and causes major problems in social or work situations and how well you get along with others. They also can affect your ability to do your usual daily tasks. Generally, post traumatic stress disorder symptoms are grouped into four types, that is, intrusive memories, avoidance, negative changes in thinking and mood, and last is changes in the physical and emotional reactions. So, symptoms can vary over time or vary from person to person. So, first we have is intrusive memories. Let's talk about it. The symptoms of intrusive memories may include unwanted, distressing memories of a traumatic event that comes back over and over again. Next is reliving a traumatic event as if it were happening again, and also known as flashbacks. Upsetting dreams or nightmares about traumatic events, severe emotional distress, or physical reactions to something that reminds you of a traumatic event. Second, we have is avoidance. So, symptoms of avoidance may include trying not to think or talk about a traumatic event, staying away from places, activities, or people that reminds you of a traumatic event. And third one is negative changes in the thinking and the mood. So, symptoms of negative changes in the thinking and mood may include negative thoughts about yourself, other people, or the world, ongoing negative emotions of fear, blame, guilt, anger, or shame. Memory problems, including not remembering important aspects of traumatic events, feeling detached from family and friends, not being interested in activities you once enjoyed, having a hard time feeling positive emotions, feeling emotionally numb. And the fourth one is changes in the physical and the emotional reaction. So let's talk about it. So, symptoms of changes in physical and emotional reactions, also called as arousal symptoms, and they may include being easily startled or frightened, always being on guard for danger, self destructive behavior such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, irritability, angry outburst, or aggressive behavior, physical reactions such as sweating, rapid breathing, fast heartbeat, or shaking. This was all about the post traumatic stress disorder symptoms, which are grouped into four types. Next, we'll talk about the intensity of the symptoms. So, over time, post traumatic stress disorder symptoms can vary in how severe they are. You may have more post traumatic stress disorder symptoms when you are generally stressed or when you came across reminders of what you went through, including the same time of year when the past traumatic event happened. For example, hear a car backfire and relieve combat experiences. Or you may see a report on the news about a sexual assault and feel overcome by memories of your assault. They are just examples, okay, of the intensity of the symptoms. Now, next we'll talk about when to see a doctor. So, talk to your healthcare professional or a mental health professionals if you are having disturbing thoughts and feelings about a traumatic events for more than a month, especially if they are severe. Also, see a health professionals if you are having trouble getting your life back under control. Getting treatment as soon as possible can help prevent post traumatic stress disorder symptoms from getting worse. And secondly, if you have suicidal thoughts, then you need to see a doctor immediately. Next, we'll talk about the etiology, that is, what are the basic causes which are responsible for developing post traumatic stress disorder. Let's talk about it. Other mental health problems such as anxiety or depression, drink too much or misuse drugs, do not have a good support system of family and the friends, have blood relatives with mental health problems, including depression and post traumatic stress disorder. These are the risk factors. Now, traumatic events that raises the risk. The most common events that can lead to post-traumatic stress disorder include combat exposure, childhood physical abuse, sexual violence, physical assault, an accident, being threatened with a weapon. Okay, so many other traumatic events can also lead to post-traumatic stress disorder, such as fire, natural disaster, mugging, robbery, plane crash, torture, kidnapping, a life-threatening medical diagnosis, a terrorist attack, or other extreme or the life-threatening events. Now, next we'll talk about the complications of PTSD. So, post traumatic stress disorder can disrupt your whole life, your education, job, how well you get along with others, physical health, and enjoyment of everyday activities. So, having post traumatic stress disorder also may raise your risk of mental health problems such as depression or anxiety disorders, issues with the drugs or alcohol use, thinking about and attempting suicide. Now, next we'll talk about diagnosis. Let's talk about the investigations. To diagnose the post-traumatic stress disorder, your healthcare professional likely will do a physical examination to check for the medical problems that may be causing your symptoms. Mental health evaluation, that includes talking about your symptoms and the traumas that lead up to them. You also may fill out questionnaires asking about your experiences and the symptoms. So these are the investigations. Now, next, we'll talk about the treatment. So, what is the ultimate treatment for post traumatic stress disorder? So, yes, here we are talking about the homeopathic medicines and the homeopathic treatment for the post traumatic stress disorder. So, let's talk about it. So, as we all know, that homeopathic medicines are made up of natural substances and they are very safe. And the advantage of homeopathic treatment, those needing it frequently recall the traumas faced in the past. They feel sad all the time, along with weeping spells. They isolate themselves after the traumatic events. They have no desire to do work, either mental or physical. Irritable frequently. They feel afraid to form relationships with a trust deficit in others. Third medicine is Califos. So, Califos is helpful in managing various issues in the post traumatic stress disorder cases. Firstly, it is very effective in managing sleeplessness. It is also useful for excessive restlessness during sleep, and it is well indicated to manage nightmares, means frightful dreams, and is its use is also suggested to deal with the depression, sadness, and anxiety and memory issues. Next medicine is Staphysagria. So, this medicine is most suitable to the person who developed post traumatic stress disorder after some sexual or physical abuse. It acts well when a person keeps dwelling on the past unpleasant incidents. There occur spells of anger. During anger outburst, the sufferer tend to throw or break things. Additionally, there is a feeling of guilt and self-pity also predominates. Worthlessness, depression may attend. And the next medicine is sepia. Let's talk about it. So sepia is very useful in the person who become indifferent and shows an aversion to family, friends, company, and sympathy. They do not wish to do any work. They feel helpless. Weeping episodes often occur. They have anxiety about They have anxiety along with fear, flushes of the heat, especially in the evening. They get irritable and offended easily. Next medicine, that is autumn mat. So it acts well when the sufferer is intensely depressed, has no hope, and has self harming or suicidal thoughts. Future seems dark to them. They have no love for life and desire death. They get offended easily. They overreact to any situation that seems to hurt their feeling. Medicine is coffea cruda. This medicine works well in the cases where there is sleeplessness, with the continuous flow of the ideas in the mind. Mental activities keeps a person awake and make him restless. It is also indicated for restless sleep, with tossing and turning in bed from side to side. The person may wake up frequently from sleep with a sudden jerk. Next medicine is opium. So opium act well in the cases of post-traumatic stress disorder when the person is sleepy but unable to sleep. Some noises coming from far away distance keep the person awake. The person develops fear of the fright, that is sudden feeling of fear or shock, which remains for a longer time. Next medicine is aconite. So this medicine should be considered to deal with anxiety and panic attacks in cases of post-traumatic stress disorder. The person who need this medicine are terror stuck and are afraid to go out. During anxiety spells, they feel very restless, they have fear of death. It is also indicated when the thoughts of an unfortunate even haunt the person with marked anxiety and restlessness. Aconite is also well indicated to manage nightmares in post traumatic stress disorder cases. Now we have the last medicine, last but not the least, that is Nux vomica. So when the patient shows violent anger spells, the person get offended easily, may get angry even without provocations. Okay, so these are the various homeopathic medicines which can be used for the treatment of post-traumatic stress disorder. So that's all. In conclusion, I want to say that homeopathy offers a compassionate and individualized approach to treating post traumatic stress disorder by addressing the emotional, mental, and physical symptoms of the traumas. So, by selecting the most appropriate medicine based on the patient's unique symptoms and constitution, homeopathic practitioners aim to provide deep and long lasting relief from the debilitating effects of the post traumatic stress disorder. So it is very important to note that while homeopathy can be highly effective, it should be used under a guidance of a qualified homeopathic practitioner. And don't take these medicines by yourself. Always consult a homeopathic doctor first. Okay. And additionally, homeopathic treatment for post traumatic stress disorder can be complemented with other therapies such as counseling, cognitive behavior therapy, that is CBT, and support groups to provide a comprehensive approach to healing. So, thank you so much for your attention, and I hope this information has shed light on the potential benefits of homeopathic medicine for managing post traumatic stress disorder. So, that's all for today. If you find this video informative, helpful, and especially valuable, so please give this video a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insights into the world of homeopathy and natural healing. Thank you so much for joining me on this exploration of homeopathic treatment for post traumatic stress disorder. So, until next time, take care. See you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from post traumatic stress disorder or any other illness, you can contact us for online appointment. On the screen, you can see how to contact us.